So then now I'll move on to the themes that cover the key factors to consider when determining suitable health and work support services from the patient's perspective. So the first one is flexible working. So an important health and work support factor was this, and in particular, participants identified that the autonomy to adjust their work timings, the location, and environment as valuable in remaining employed, especially if their symptoms fluctuate. Many of the participants were actually self-employed, which can help with the flexible working. But at the same time, this was associated with its own challenges, including financial instability, business disruptions from health-related absence, and losing clients from perceived unreliability. So consequently, it can amplify the consequence of their poor health and reduce the actual flexibility. Another important health and work support factor identified was the accessibility of the support. So there was a strong desire amongst participants to have a more simplified health and work support system, such as having a holistic service, everything all in one place. This saves them time from going to different multiple services for different things and reduce the risk of them missing potential support that they weren't aware of, because they view it as if it's all in one place, then I can't miss any other benefits that I wasn't aware of. Um, and then there's a centralized online health and work support information source that they think would be helpful. And ideally, this would be hosted on something that's already well established and trusted, like the NHS website. So some identified this written information would be valuable because it helps them to initiate workplace support conversations with their managers, and it helps them to also assess the reasonableness of their request and to verify the accuracy of some of the health and work support advice that they're receiving. They would also like a more flexible access to health and work support. So, for example, the modality of accessing health and work support, they prefer to have a variety of in-person, telephone, and video option. And this is beneficial because it suits different clinical needs, the convenience, and just personal preference, really. Like some people prefer in-person because they can build a rapport. And then whilst, like I mentioned, some participants wanted everything in one place, there was also a general desire of flexibility to access health and work support through different services at the same time. This includes the job centre, the GPs, and their specialists. They felt that the benefit of this was the convenience, the ease of access, and familiarity with their medical condition. And also, because most individuals would be registered with a GP, a participant felt that, it meant that health and work support advice from them seemed ideal to make sure that everyone had access to their support. And then to improve health and work support accessibility, participants also propose an option to self-refer themselves or referrals from their treating doctor to health and work support. Timely support is important, so some participants suggested an automated health and work support referral that could be triggered maybe from the GP fit note. And then due to different working hours, then there was demand for some out of hours health and work support access or online access as well. Participants also valued health and work support at various stages of their health and work. So including at the point of diagnosis and beyond, or pre-employment to aid identifying suitable work for them and helping them with the application process and the relevant training for it. Several also recommended workplace health promotion programs to prevent ill health in the first place. So there's another important health and work support factor is for employees to feel supported and valued. One way of achieving this was obviously kind of implementing the workplace support or adjustments that have been requested. However, empathy from managers and colleagues were also highlighted as an important factor and can determine the level of workplace support received. So a participant expressed a fear of being perceived as lazy when requiring adjustments or sickness absence. In fact, the next slide, the quote was an illustration of this. It says here, I think where it's challenging is when you don't have that support around you and people don't really understand it. So they mistake people with autoimmunity as just just sort of being lazy, or take it unnecessary sick days, as opposed to the fact that it can make you extremely tired. So that would be massively impacting on your ability, to focus on things. Another interesting sub-theme under this that we noted was employer hypocrisy. This is where the support claimed by the employer doesn't quite match up with the employee experience reported by the participants, so they can actually end up feeling quite unsupported. So I got a quote here that sort of demonstrates this quite well. So it says here, I've seen a lot of well-being washing in my time. I've been in organizations that will plaster online and on social media that they're doing a lot for well-being, and they'll say internally they're doing a lot for well-being. But then employers can feel very much otherwise. You're a puppet for the senior leadership team. I thought that the fact that they use the word puppets, kind of like suggests that they're being manipulated to sort of enhance their companies or businesses' reputation. So this is just a reminder of what was the aims of our study. So which is, to understand how best to develop and deliver health and work support from patients' perspective. So that the type of support that they want, the setting, timing, the mode of delivery, who to deliver it, and how this can be linked with existing services, and to what extent they think employers would be receptive of the information on supporting their health and work. So I've therefore summarized the responses to these research questions here. So in terms of the type of support, so from the health and work support services, like I said, there was some mentions of having everything in one place. In addition to impartial advice, there was a desire for holistic services, so including financial support or signposting to medically relevant support groups, and also pre-employment support to help them identify suitable work with relevant training. In terms of written information, employees, self-employed individuals, and business owners all wanted clear written guidance outlining the available health and work support, both within and external to the organization. There was a desire for condition-specific workplace adjustment guidance, and also some communication advice. So some wanted advice on how to initiate discussions with the employers about requesting adjustments, so that it's sort of seen as beneficial for both parties. And then hosting the information as well on NHS website was proposed, because it's already a website that patients are accessing, so they felt that this naturally was an ideal place to put the information on. And actually the website itself currently does hold some general health and work support information, and depending on the condition, there's some conditions that actually have some guidance related to work already. So for example, depression does have some information in it, but there's quite a lot of other health conditions like diabetes, epilepsy, etc., that might not necessarily have the work information, work guidance on it yet. And then there's workplace interventions. So there was a desire for a health promotion program, but also that the workplace does provide manager training to improve the long-term health condition understanding, and making sure that managers are aware of what health and work support is available to give them the support in a timely manner, and also to approach them empathetically to address the sort of disability discrimination that we discussed earlier. In terms of where, how, and who to deliver the health and work support, the responses actually were quite varied, but what was noted was important factors for consideration were convenience, the medical knowledge, impartiality, and the confidentiality. So GPs and specialists were seen as convenient and knowing the patient well. Occupational health was valued for impartiality, although there were some concerns about independence that were noted in the Mayfield report. And then there's medically trained advisors were preferred for their clinical knowledge and confidentiality, and also the importance in terms of mode of access to have the flexible access options of face-to-face, phone and video. And this is probably reflecting after the pandemic, the change in delivery of healthcare. In terms of timing of health and work support, really the participants wanted health and work support throughout their whole health and work journey. And this is echoed in the Mayfield report, in the health working life cycle that they mentioned in their report. So participants, they wanted evidence-based workplace health promotion. So the Chartered Institute of Personnel and Development reported a rise in organizations adopting well-being strategies, so about 57% of them. Yet occupational health remains underutilized, so only 29% actually involved them in the design of the health promotion program. So really greater occupational health and HR collaboration is recommended to ensure evidence-based well-being initiatives, and this is further reinforced by the Society of Occupational Medicine and Mayfield report. And then to enhance accessibility, participants proposed out-of-hours access and online health and work support. So for example, like the NHS website. And participants expressed a strong desire for pre-employment support as well. But actually, really, this already exists in terms of pre-employment support. Now, the fact that the participants are asking for it despite it already exists suggests to me that there is probably limited health and work support awareness of what's available. So the existing support include the Connect to Work program, and this is supported employment program as well from the that's recommended by NICE, and there's also the NHS guidance for IPS embedment in the community mental health services. So there's a few sort of health and work support already out there. However, like I said, one of the participants was a psychiatrist, and he felt that there was insufficient clinician training to provide this occupational advice, even though it is in the NHS guidance. And this is kind of consistent with the Mayfield report. So this kind of why I'm highlighting this is I think that this sort of suggests that there's a disconnect somewhere between the government and NHS initiatives and the need to raise public awareness so that people are actually aware that these initiatives are out there, and actually the stakeholders in terms of, like, for example, the clinicians being trained to feel that they're able to deliver these initiatives as well. So recently, there's also the Connect to Work program plans to place job advisors actually in the GP surgery. Now, this has raised some concerns, I think, in the GPs, that this might deter people that want to go to the GP surgery for medical visits. However, we feel that this study that we've done supports this change, because it actually, by placing them in the GP surgery, it enhances the accessibility and the awareness. And then in terms of links with existing health service provision, like I said, participants preferred the GP and specialist appointment to include some sort of health and work discussion or signposting. Health and work support referral options via their treating doctors would be helpful, and also self-referral was proposed, and probably an automated GP footnote once they've been signed off to be triggered for a referral to health and work support. And then those in work, especially the 31% that don't have OH access, which includes the 61% of small, medium businesses, they're often unaware of how to access support. So perhaps this aligns with the call for a national occupational health service, although the current OH capacity is limited. So here is just a slide to show some of the factors which participants noted affected employer acceptance of workplace recommendations. I won't go through them all, but it includes the disability visibility that was already mentioned earlier. So in terms of the strengths and limitation of this study, it's worth noting that both researchers and myself and another colleague of mine who conducted the interviews and analysis were both occupational health physicians. So, so obviously our health and work support experience would likely influence our interpretation of the data, and but it also helps to contextualize the participant responses and then come up with meaningful themes. Um, and it's possible that researchers with a different background could have identified slightly different themes. The strength of this study really is the diverse cohort of participants. So we had uh, individuals with different health conditions, physical and mental, different work status, so in work and self-employed and out of work. And there's also different work sectors as well, and different geographical areas, so they're quite widely distributed. Um, and then it was also promoted through a wide research network, so reaching out to a wide range of potential participants. In terms of limitation, selection bias is likely since the study participation was voluntary, and the participants who did participate probably had particularly strong views and more negative experiences, which may have been reflected in some of the highly emotive and opinionated responses, which I quoted a couple as well today. Um, Additionally, the sample was smaller than we anticipated, and they were predominantly female of white ethnicity and self-employed as well, so which may limit the transferability of the findings to a broader demographic group. However, according to information powers theorized by Walterud, the case analysis strategy, the strong quality of the interview dialogue, and the dense sample specificity are in favor of the smaller sample size, providing sufficient information power. So really, in conclusion or summary of our recommendations, this study does offer a valuable insight for health and work practitioners, the commissioning bodies and policymakers to try and improve health and work support service delivery, contributing to the NHS Fit for the Future 10-year health plan. And it supports the recommendations from the Keep Britain Working that a shared responsibility and partnership between employees, employers, and government is required to help keep individuals with long-term health conditions at work. So we identified that the main health and work issues that are important barriers to address are the health and work. So there's the disability discrimination, health and work support unawareness, and the trust concerns. So I've broken down the recommended actions for employers and commissioning bodies. So for the employers, they are encouraged to review their existing health and work support policies to ensure that it is accessible and well publicized. And this needs to be supported with regular manager training as well to ensure that they are familiar with the policy, how to access health and work support, and to approach uh, the employees in an empathetic and supportive manner and avoiding disability discrimination. And there's also evidence-based workplace health promotion programs in collaboration with occupational health are advised. And then for commissioning bodies, really the main message is that we recommend to provide a simplified, holistic, and better publicized health and work support. It may be that there's a lot of health and work support available at the moment, but there's, like the study highlighted, there's a lot of unawareness, and perhaps because there's so many different services, it's probably a bit fragmented. But if you unify it into one simplified, holistic health and work support, it's probably likely to improve that. And also to help address the possible disconnect between the policy and practice. And whilst the Mayfield report, it did propose a widespread non-clinical workplace health provision and identified that current limited occupational health capacity. This study suggests that participants did prefer health and work support to be in one place and with medically trained advisors. So we would suggest expanding occupational health capacity for additional clinician training, and possibly a national work and health service, such as a national occupational health service, is proposed. And in the meantime, it also includes perhaps training non-occupational health clinicians to incorporate more health and work support discussions during medical consultations. We also propose displaying information in medical waiting areas, and expanding the existing NHS website information so that it contains more condition-specific work advice and information for self-employed individuals as well, and business owners, so that it enhances their health and work support awareness. So finally, although this study does provide valuable insights into the patient's preference for health and work support delivery, we think that further research is needed to gather perspectives from other key stakeholders, including employers and multidisciplinary practitioners as well, from primary and secondary care.